Coming up on Chamber Today, we're doing a special report on the status of many of our local businesses during this COVID-19 event. This starts now. I'm Aaron Stern, a local business owner and also a member of the board of directors for the Spanish Fork and Salem Area Chamber of Commerce. Here we are 2 months into our COVID-19 isolation period. Our businesses have all suffered in some way or another. Now we've been given permission to start reopening, so we're going to talk about that. We have many guests with us today from a variety of professions. Please welcome Dave Anderson, the Director of Economic Development for Spanish Fork City. Also Lance Wilson of State Farm Insurance, Brian Kessinger from the Utah Department of Workforce Services, Nathan Black from Mountain View Hospital, Jesse Carden from Griffis Biomat, and Heather Yaud from the Chamber of Commerce. Welcome, everybody. Let's just start with how we're standing today. You know, we've had a rough couple of months, and how's this impacted everybody over the last several months? I guess I'll start with one of my businesses. So, you know, my wife and I have a boutique on Main Street, which we closed the last week of March, and pretty much had to find a source of work for our employees so they wouldn't have to go on unemployment. So we had them doing odd jobs in our warehouse. We had them painting some of our building, just doing some things so we could give them their hours that they were used to. But luckily, we did open up our store this last Thursday, and actually it's been pretty great. Business has kind of just picked up right from where it left off. Hey, Brian, you had something you wanted to say?
Yeah, just really interesting how, you know, all the restaurants have adapted, and, you know, the curbside service, and just, you know, in my office, we actually had to lock the front doors, and we put numbers on the outside. When we first started that, you know, we only let 10 people in the office, and then we gave them numbers. They went and sat in their car, and then when someone left, they were able to come in. And then later on, our employees just didn't feel safe as we saw more people, you know, sneezing and looked like they had some symptoms. So we actually locked our doors and just put phone numbers and served them through the phone and the internet. Wow. But it's certainly a crazy time how we've adapted during this change.
Yeah, I mean, I know, you know, obviously everybody's heard about how the unemployment claims have gone up. Have you seen that plateau at all, or have you seen that start going down, or is it still increasing?
It's kind of tailored off a little bit. We were averaging about 20,000 a week, which is really insane because last year we averaged about, for the whole year of 2019, was around 30,000 claims. So we're literally doing a year's worth of work in 3 weeks. And that was before the self-employment unemployment assistance. I think they're calling it pandemic unemployment assistance, or the acronym is PUA, and that just opened up a couple weeks ago, and so we're seeing a lot. In fact, we're now getting approved for overtime just to process those claims. So we're extremely busy, and it's just a crazy time for us.
Wow.
So, Brian, do you expect that to taper off quite a bit more now that everything's starting to open back up and people are receiving their PPP payments and they're calling employees back?
That's what the program was designed for. You know, the loan was designed to, you know, help businesses not lay off people, not furlough, keep them employed and keep them working. But once the employees are laid off, if they're laid off long enough and start to collect their unemployment insurance, so they get the state of Utah unemployment insurance rate and then the federal unemployment insurance rate, which is a blanket $600 on top of the state. A lot of employees are making more money on unemployment insurance than they would at their jobs. So there's this really strong tug of war effect that, you know, when employers want them to come back to work, you know, they don't want to leave the unemployment because of the financial benefit they're receiving. So it's a real tug of war between employers and employees, and I think it's a difficulty that was kind of unexpected.
Yeah. Wow. Hey, so Nate, from a healthcare perspective, have you seen things taper or plateau off, or how's the current situation from a hospital viewpoint?
It's been a really interesting ride. Of course, the first concern that we've all had is that we're able to take care of all of the members of the community that might get sick, and planning for a surge in people coming in with respiratory issues to the hospitals and to doctors' offices and so forth. And so I think as this ramped up, we prepared for that. So there was mad scramble to make sure that everything was ready to accept patients that were having these issues, and to make sure that everyone who was coming in was taken care of in a manner that would allow them to stay safe. And what you've seen in the community is that they're keeping the rules that state has put in place, which is wonderful. Um, but it's also had a dramatic impact on doctors' offices, on the hospital itself. We've seen the drop in volume, a tremendous drop, as we've been empty essentially from the standpoint of surgeries and so forth.
Mhm.
So it's been a real challenge. We're lucky to be part of HCA Healthcare, which is the largest hospital company in the United States, and our employees that we redeploy. So we have had OR staff. They've been screening people as they come in the entrances of the hospital, doing different jobs where they can. And then those that cannot, they've been helped with what we call pandemic pay. And they're being paid at about a 70% rate for any hours that they would normally get.
Okay.
So that's been a huge benefit for our people. But it's been really hard, I think, to not have the normal stream of business for not just the hospital, but for our local doctors.
Mhm.
They see patients that have real need to get surgery, but we're all being very cautious about overuse of personal protective equipment and so forth. I think at this point we're at a place where we feel confident that we have enough, and we're pleased with the changes in the governor's plan, that we've gone to orange, and we're seeing more scheduled surgeries now, and ramping that up, and that's a huge benefit. And our doctors' offices are bringing the staff back that have been kind of off, so that they can schedule visits, and so we're starting to see the healthcare sector pick up a little bit, which is really really good, because everyone is, I think, assumed a little bit that, oh, there's so much going on at the hospital, we need to stay away. And in fact, we've been kind of like everybody else, dying on the vine. We need more business. We need to bring people in and give them the surgeries that they need.
Cool. Yeah. Well, it's great news that things are starting to pick back up again. Jesse, from the Griffles standpoint, how have things been going?
Yeah, thanks, Aaron. Things have
Yeah.
been different the last little bit, just like with everybody else. We've had to cut how many donors we can take at any given time, just to ensure that we keep the proper distancing within the center. We have, similar to what the hospital has, in that we have temperature checks or checks before people come into the center, both our donors and our employees, just to ensure that we're trying to keep everybody safe at all times in the center. But as you hear on the news and different things, plasma is essential, both from those that already need it, and we're seeing more and more that plasma might be an answer to some of the things that COVID related. There's centers across our company that have teamed up with the FDA to start getting plasma, or having plasma donated from patients who have recovered from COVID-19, and hopefully to be able to make those into medications here in the next little while. And we have one in Sandy already, and then one of the Provo centers will start doing that here shortly as well. So
Wow, that's great.
yeah.
Awesome.
Cool. And Lance, from the insurance side of things, how have things been progressing and looking?
So obviously there's a large need for clients to continue to be insured. They've got to still have car insurance, homeowners insurance, and those needs have not gone down. We've had several claims where people, I need help getting through this car accident, or I need help with flooded basement. And so certainly our demand has not gone down really at all. What's been a challenge is that we've been asked to shelter in place here in our office or work from home. And the question becomes, when do we open up our office again and start allowing customers to come back into the office? Or when do we start asking our employees to come back to work and work in the office rather than having people just working at home? It's not as effective to have them working at home versus having them here in the office. And we're not as effective, perhaps, when we're not face to face. And so we're trying to figure out when is the appropriate time to start allowing people to come back into the office and to have employees working in the office.
Yeah. Do you think you have a timeline from that yet, or are you still taking kind of a combined guidance from both State Farm and the governor?
And the state, yeah. So based on the governor's descaling is from a red to a yellow, or excuse me, orange. We've opened up our office lobby again. We just asked customers not to sit down, just to kind of work, dropping things off and whatnot. And as far as employees, yeah, that's a good question. When do we tell the employees you need to start coming back to work, not just working from home? We're still a little bit up in the air on that.
Okay. Heather, I was going to ask you, so what have you been hearing from some of the local businesses with the chamber as far as when they're going to be opening back up?
So I think it really depends on your industry. I know that like food places are really scrambling to try and make everything safe and secure for their customers to get back in. Others I don't think are in quite a rush, to get back in. So I think it really just depends on your industry. So.
Okay. Yeah, like I mentioned earlier, so our retail stores opening back up again, and we've seen that really from community to community, the demand may be different because our store up in Draper, it's a very different environment up in Salt Lake County right now than it is down here in Spanish Fork. So we're just kind of going along with the guidance of both the state and kind of the community. So speaking of communities, Dave, City Hall's back open again today, right?
It is, yes. We're excited about that. We look forward to being able to get a little bit back to business as usual without really fully being back to our pre-COVID way of being able to serve the public, but that's a great step. We've opened some other city facilities here recently in the last few days. Likewise, we're excited about that. We continue to follow the different directives that we've been given from the state, whether it's Utah Leads Together or the subsequent counsel that we've been given relative to how to operate to keep our customers safe and employees and so forth. But anything that we can do to be more robust in how we serve the community, we're excited about that, and certainly looking forward to at least the possibility that more changes are going to be happening soon.
Yeah. So are you guys limiting the number of people that come into City Hall at any given time?
Not by number. We are certainly encouraging people to exercise proper social distancing. When appropriate, we ask that people use masks as they come in to do particular things with city employees and that type of thing in our building. By and large, I think we're simply doing the very same things that you see a lot of folks do in their local or in their businesses here in the community to try to keep people safe and yet be able to conduct business.
Okay, great.
So I'm curious if any of the other businesses along, the gambit of things are requiring people to wear masks when they kind of open back up. Is that something any of you are thinking about?
Well, I can say from the hospital perspective that we're in a universal masking protocol. So when visitors come and there's a limitation on the number of visitors that can come. It's one per person or per patient, but that they are given a mask when they come through. And all employees and doctors do.
Heather, in a professional services industry like insurance, the amount of people that we see at one time is not that great. So we can exercise social distancing, and we're not requiring people to wear masks, nor are we wearing masks. Obviously, we're not a department store or a grocery store where we see a lot of people at one time. So I suppose that the mask requirement may be based on individual, demand or requirement of that business. Certainly in the professional services industry, I don't see it as much of a need.
Yeah, I can see that.
Yeah, cool.
It will be interesting to see what is required, though. But I think I heard on the radio that when we move into different areas of opening things up. I think I heard our governor saying that in some areas they were going to require people to wear masks, or at least to be cautious that way. Again, I think it's just something I overheard, but it'll be interesting to see how that rolls out, and who complies and who is it required for.
Yeah. It'll be interesting to see how that all plays out. We'll be right back with more after this commercial break. Welcome back, everyone, to our special report on COVID-19 with Chamber today. And let's start off the discussion about how businesses are planning to reopen or how they have already reopened. And as always, our disclaimer is that we as local business community professionals, we've never been through this before. So we're kind of taking baby steps here. We're getting guidance from multiple sources, but we're also doing what's best for not only the community, but our businesses. So Brian, can you give us some input from your perspective?
Yeah, thanks, Aaron. So, as you know, the Department of Workforce Services, we work with a lot of companies, and it's interesting to see how different industries are tackling this crazy time of the coronavirus, and some of them, sad to say, aren't going to survive. We've seen on the news where, some of the antique dealers and these mom and pop shops that have high rents and high expenses. They've come out and said, we're done, we're going to retire, we're not going to make it. And other industries have scaled way back and laid off people. And I think it's really, as I'm talking to different companies, it's really interesting how those that have a real strong positive attitude and try to look at okay, this is an opportunity for us, and they start to talk to their employees, and they're saying, we haven't been through this before. We're writing new policy. What, is there a marketing opportunity here? How can we reach out, connect to our customers? They need to feel safe. We need these things happening. And they also take an opportunity to get rid of employees. They're cleaning house. They're like, if you're not a dedicated and loyal employee, they're happy to let you go collect unemployment, on the government's dime, and don't come back. And so they're really kind of just looking at this as an opportunity, and I really appreciate those companies. And then you have these other companies that are just, they're just whining, like, oh, why did this happen? This is horrible. It's almost, Aaron, it's almost like raising a kid, right? You got different personalities in children, but you have these different personalities in employers and the different industries. And I really think the recovery is going to be difficult for your hospitality and your travel industries. That's going to be a slow and difficult recovery, but it's really kind of wait and see and see how they tackle this change coming out, and take the opportunity for bringing on more customers.
Yeah. This might be a combined question for both Heather and Dave, but as a business in the community, what kind of resources can either the chamber or the city offer to help guide the reopening process?
Well, I think from the chamber perspective, a lot of what we can do is more just informational. We don't have a whole lot of resources that we can, physically give to people, but we have set up a page on our website for coronavirus information. I know that we have the governor's plan to lead, or I can't remember the name now. The plan to lead 2.0 basically, and it's on our website, and also more along the description of this new phased opening. We have those on there as well. So if you have any questions about opening your business, you can go to the website. You can get detailed information for each phase, whether it's red, orange, yellow, or green.
Okay, cool.
Much like the chamber, the city as well, just trying to do what we can to make sure that people have the best information at their fingertips, so that, among other things, hopefully our businesses have been able to tap into the resources that are out there, whether it was a small business administration loan or the PPP program, any of those different types of things. And I think that, frankly, with the help of some of our local banks in particular, folks in the community were able to get that type of assistance, and certainly hope that that helps really blunt the adverse impact maybe that this time's had on some of the folks in town. But in essence, like Heather said, that's really, I think, the same thing that we as a city have tried to do, just to make sure that we're up to speed with the different sources of assistance that are out there, and trying to make sure that the business community understands how to access that. And going forward, we don't really know what the future might bring. I think we're open to any suggestions or ideas. We wonder at this point, I think, if we really have the worst behind us yet or not. Want to be optimistic and hope that it is, and that things will start to get back to what we knew as normal again quickly. But I certainly wonder, as maybe folks beyond just the hospitality industry and maybe retail, some of the others, healthcare certainly, that really got hit hard, if the impacts may be going to carry over into manufacturing or construction or any of those types of things, which certainly are a big deal for the city. So maybe a long answer to your question, but that's where we're at.
Okay. Lance?
So I don't know if this is a resource, but this is certainly an idea that I think the community, as well as those on this call, should be aware of. My conversations with customers who are businesses, so we do a lot of business insurance, and a lot of our food services industry, the clients that we insure in that industry are desperate to get employees back into their stores to reopen the store. For example, I'll give you a quick example. One of my clients is the owner of Pretzel Maker, and you see the Pretzel Maker stores in most of the malls across the Wasatch Front. Well, since they've been shut down because the malls are locked and they can't get in and provide services or provide their product, most of those employees are gone. And now that they're ramping up to reopen these malls and these food services, like Pretzel Maker, my client has said, all my employees are gone and I can't get any more employees back, or they don't want to come back. Like Brian mentioned, they're on, they're getting more money from unemployment, or they've had to go find another job, and they're saying, hey, I've found another business or another industry. And so I would say, as far as a resource to the community, go check out some of these food services type businesses. They may be the most inclined to want to hire, whether it's a manager or assistant manager. I think that they're probably in perhaps the best position to be bringing people back on, because their former employees have gone elsewhere. So that was talking to Mr. Pretzel Maker for anonymous reasons. He said, I've got stores all across the Wasatch Front that I am desperate to find employees to come and work. So food services.
Cool. Definitely. Yeah. Hey, Brian?
Yeah, so I really love what Lance was saying. Look for the opportunities in this, and maybe it's a blessing in disguise that you're going to be able to be more financially stable than before. There's opportunities in this, and I think there's a balance too. We want to get to normal so quickly, but we still got to be careful, because everything I'm reading and hearing, that when the cold season comes again, we might have an uptick again in this virus and might come back stronger. So we want to normalize as quickly as we can, but we got to do it in a safe way, that it's a balance, so this doesn't come back and hurt our economy again. I just think that's a really important thing to strategize.
Yeah. Nate?
And if I could just say to that point, I think that the general community really wants to get back out, and they want to be out in Pretzel Maker and wherever else. And one of the things that we can do as businesses is provide the right kinds of information about what we're doing to protect the people who come to our locations, and let them know that it's safe to come to where we are, so that because there's a lot of fear out there, but there's also a lot of pent up demand. I think people really, really want to get back out and doing things. And if we can have those processes in place and then let people know about them, they're going to be a lot more comfortable coming into our business.
Yeah.
Aaron,
Seems like
Oh, sorry. I was just going to chime in real quick. It seems like if people are practicing social distancing practices, washing their hands more regularly, keeping their distance. Maybe we don't shake hands as frequently or hug like we used to. Hopefully, by this fall, we'll be in a little bit safer place so that even though our businesses and the economy is open back up, we're not forced to completely just shut everything down like we were in March.
Yeah, I think we'll be much better prepared for this next go around if there is one. Jesse?
I think the important part too is, as a business, is just making sure that we're doing everything we can to educate our potential customers or donors or whatever they may be to what we're doing to help them out. Because as has been stated already, is they're ready to come out, but they want to know what we're doing to help them to stay safe in this time.
Yeah. Yeah, there's definitely demand, at least from my perspective. I've seen, it seems like the more people are being told they can't go out, the more they want to go out. And so now that the community is starting to open back up, people are definitely taking advantage of that and going out and shopping and doing everything they need to do. So, and again, we want to thank everybody for joining us today. It's been a great discussion. And there's great resources on both the Chamber webpage as well as the city webpage. And thank you again, everybody. And remember to shop local. Thanks so much.
Thank you, Aaron.
Thanks, Aaron.
Thank you.
Thank you.
Thanks.